Actually, not all rotator cuff tears are the same. I have a lot of patients that will come in and say they've been to physical therapy and someone else is there that's had a rotator cuff tear and they're progressing at a different rate, they're having different symptoms. So it comes down to not all rotator cuff tears are the same. We start with the basic of whether the tear is a partial tear, which means that there are still some fibers of the rotator cuff attached to the bone. It's more like a fraying of the rotator cuff as opposed to a true detachment. A full thickness tear is where the tendon is not attached to the bone in a certain section of the rotator cuff. Depending also is the size of the tear. There's a difference between small tears and larger tears as far as their chances of healing after surgery, re-tearing rates, and also how long it takes to fully recover from the surgical procedure. As far as the partial tear with the fraying, there are a lot of times where that can be treated with non-surgical options such as cortisone injections, anti-inflammatories, or physical therapy. If that is not successful, then surgery options are available to help take care of that. For full thickness tears, it really depends on the size of the tear, how the tear happened, the age of the patient, their activity level, to determine what's the best first treatment for that. Kind of a guideline, if it's a younger patient that's had either a sports injury, car accident, a fall that resulted in an acute tear, usually the recommendation is to start off with the surgical repair of that rotator cuff. If you have a tear that's in an older patient that may be more degenerative, something that's developed over years, a lot of times those can improve with non-surgical methods like the cortisone injections and physical therapy. If that does not help, then a rotator cuff repair is a nice option for that patient. There is a spectrum of tears in the older patient population. Those tears that are degenerative usually have started, even years before they start having symptoms and have slowly gotten larger over time. As the tear gets bigger is when they start having more symptoms. Some of those tears can still be repaired with an arthroscopic or open rotator cuff repair. Other tears have actually gotten too large and have pulled too far away from the bone that they can no longer be repaired. In that patient, a lot of times they'll still get better with physical therapy or cortisone injection. There's sometimes an option to go in there arthroscopically and kind of clean up the tear. The biceps tendon in that case a lot of times is causing symptoms, and so a release of the biceps tendon can help a lot with their pain. Other patients need a type of shoulder replacement called a reverse shoulder replacement that bypasses the function of the rotator cuff that will help them with their pain. For that procedure, it's a very in-depth, more complicated procedure that we don't offer lightly. It's more of a salvage procedure for patients who have not improved with other methods, and it's the most successful for patients that have lost the ability to lift their arm away from their body because of the size of the rotator cuff tear.